I encourage you to create a balanced study plan. You have to develop a mixture, 50% based on knowledge and comprehension, but most important, the application of the knowledge. And the other 50% of your time, you need to focus on developing your critical thinking and using strategies. I know some of you are asking this question. I study a lot. I went to the NCLEX and I failed. Why? I would like for you to ask another question. Did you study in a passive way versus an active way? Did you control your studying environment? Or did you practice NCLEX questions that were free, too easy, outdated, or from an invalid sources? These are mistakes many students that go to the NCLEX and fail make. It is extremely important that you study in an active way. You have to do something every day that brings you closer to your goals and dream of becoming a registered nurse. Would you like to know 4 steps that you need to follow to pass the NCLEX? Stay with me. Get the help of a mentor. Each one of us need a mentor to help us improve and go to the next step. Step number 2, nursing content cannot be memorized because there is too much information. NCLEX success is based on the application of content. You need to have the ability to analyze, develop, and understand the pathophysiology of nursing. Let's talk about the difference between memorizing and thinking critically. If I ask you, what are the local signs and symptoms of an infection? You will tell me heat, erythema, pain, edema, and exudate. I know all of you know this answer. But the most important question is, why? Why does a patient with a local infection have signs and symptoms such as heat, erythema, pain, edema, and exudate? Passing the NCLEX has to do with the ability to apply content. You see, in a local infection, erythema and heat occurs because of an increase in circulation to the area. Edema occurs because of an increased permeability of the capillaries. Pain occurs because of the accumulation of fluids in the tissues that is putting pressure on the nerve endings. And exudate occurs because of the accumulation of fluid, cells, and other substances at the site of the infection. Step number 3 is developing your critical thinking. And step number 4 is application of prioritization strategies. So what can you do to develop your critical thinking? Everything starts with the stem of the question. You need to be able to identify the 5 key factors of an NCLEX question.